Assalamualaikum and a very good day to you. In this video, I'm going to talk about the plague attack in European countries. History. In October 1347, the plague started to make its debut when 12 ships from the Black Sea docked in the Sicilian port of Messina. Most of the sailors on board were dead, and those who were barely alive were critically ill and covered with black boils oozing blood and pus. The fleet of dead ships was quickly ordered out of the harbour, but it was too late. In the next 5 years, black deaths are known to kill more than 20 million people in Europe, amounting to almost a third of the continent's population. What is the cause of these black deaths? The infamous black death is actually caused by the Yersinia pestis bacterium. Yersinia is a type of bacteria that are carried by fleas that travel on rats. Let's talk more about Yersinia. Yersinia pestis is a causative agent of the plague and considered a gram-negative bacillus or bacteria. It can survive and proliferate in phagocytic cells, unlike other bacteria. It is also a zoonotic disease. This means it can be passed between both animals and humans. Rats, ground squirrels, and prairie dogs are the examples of carrier. Fleas such as the Noscilla shophis or Pilix eritans can also be infected. They typically eat of the natural rat reservoir. When that's not enough, they turn to humans. There are 3 types of plague: bubonic, septemic, and pneumonic. Most famous and least deadly out of the 3 would be bubonic. If untreated, bubonic has 50 to 75% mortality rate. It's not transmittable from person to person. The second and less common type would be septemic. It is also not transmittable from person to person. The last and the deadliest type out of the 3 would be pneumonic. Pneumonic as in the lungs. Unlike the other 2, pneumonic can be transmitted from person or animal to person via air droplets. Droplets of bacteria come from sneezing and coughing, so remember to cover your mouth when doing that. Said to be the deadliest one because of the 100% mortality rate. Pneumonia progresses very rapidly and resulting in death if not quickly treated. The bacteria incubation period varies and the shortest would be pneumonic. Symptoms include the onset of fever, chills, nausea, cough, vomiting, abdominal, and joint pain. The symptom also varies and worsens from bubonic to pneumonic. How about vaccination? In 1897, bacteriologist Waldemar Haffkine discovered the first plague vaccine by using himself as a test subject. It was said that the mortality rate was lowered by 50 to 85%. A plague vaccination is used to induce active specific immunity in a susceptible organism to plague by administering an antigenic substance named vaccine. The Cochrane collaboration in British identified no trials of sufficient quality to include in their review, hence they were unable to make any conclusions about the vaccine's efficacy. How to manage plague outbreak? There are 3 important ways to curb the plague. First is to find and stop the source of infection. Identify the most likely source of infection in the area where human cases was exposed and look for clustered areas with large numbers of small animal deaths. Second is to ensure correct treatment. Verify that patients are being given appropriate antibiotic medicine. Third and the most important is to isolate patients with pneumonic plague or at risk. Pneumonic patients should be quarantined so as not to infect others. Providing masks can also help reduce the spread risk. Conclusion. By the early 1350s, plague pest epidemic had run its course, yet the plague still resurfaced every few generations for centuries. Modern sanitation and public health initiatives have substantially reduced the disease impact, but it has not been eradicated. While medications are available to treat the plague, the World Health Organization (WHO) reported that 1,000 to 3,000 cases of plague persist every day in our life. Thank you.